right, we're here on day 2 GDHF, and I am here with my new friend Zaid. Tell us a little bit about your work and what brings you to GDHF 2025.
Thank you, Nick. Basically, I represent IRD Global. We're a public health nonprofit that operates in 3 countries currently: Pakistan, Bangladesh, and South Africa. We operate across a few domains such as infectious diseases, mental health, surgery, and maternal and child health. But some things cut across all these domains, and that includes digital health.
Okay.
So we digitally enable all the work that we do. One of the things that we're showcasing here is actually Pakistan's first electronic immunization registry.
Wow.
That IRD developed.
Very cool.
For one of its provinces, which is Sindh province. It's a big province, 60 to 70 million people in that province.
Serious scale.
Yeah.
Okay.
And we've been operational. So we are the architects, the developers, and the operators of that system since 2012 till now.
Wow.
And of course, it's been a long journey. So
Yeah.
it's quite a robust system. That's well, we like to say it's a very battle-hardened system.
Yeah.
And the reason why we're presenting that here, we've done a lot of other digital health work as well, but that's one of the biggest examples of ours.
I was going to say, I bet you've learned a lot in that 10 plus years,
Yes,
13 years now.
Yeah.
I would be curious, are there any kind of salient lessons learned or stumbling blocks or challenges you had to overcome to get that kind of scale and traction in a country that, I'm sure struggled with being able to identify patients and connect dots and think about data standards, all the above?
Yeah. So the first thing is, and this is stuff that we've heard here over the past 2 days at GDHF as well. The first thing is stakeholders need to be engaged and be brought on board. Of course, all of this would not have been possible had the government not backed it. But one of the ways we enabled that was that we've always raised our own funding for this. So while this system is used by the government, we actually raise funding for it, which is something we need to change right now, and that's something that we're working towards. But for the last 13 years, that's how we've operated. But we've kept them super close. We've always prioritized what they need done. And we work with EPI, with the Extended Program on Immunization, and the target is basically 0 to 2 age of children, and as well as pregnant women and mothers.
Amazing. So what I'm hearing is definitely not having the government have to pay for it allowed you to get to some of the scale. But now in this new world order, there's a little more pressure to think about
sustainability and ownership by the government. We actually intend to transition this completely to the government.
Yeah.
But coming back to other lessons learned, you have to work with the users. And again, this is a theme that is very prominent at GDHF as well, is that you have to work with vaccinators. I'll give you a small example.
Yeah.
Recently, we deployed some new modules for HPV vaccine. We recently introduced that vaccine in Pakistan. And the way our team did it was we kept the user experience so simple that we decided not to train vaccinators on it. So what we did was we gave that application to a few vaccinators and said, please use it without any training.
Oh, cool.
And they used it. It was super intuitive. But of course, there was some feedback. So that feedback was, for us, it was like, okay, we need to improve the user interface and experience more. So make it as simple as possible. So that the user can just operate it without any hurdles, because as we know, the front line is overburdened, right? We've again, a theme that's been prominent.
Yeah, I was going to say.
Apart from that, we also support the government at the district level. Which is after a province, the administrative unit is the district. So we support. So we have our team as resident consultants sitting with them, helping them use this system, helping them use the data, the analytics that are coming out of it in order to improve coverage.
So that's where a bit more hand-holding happens. If we can support them at the district level, that makes a huge difference. You make it as simple as possible to use, I heard you say, at the user experience level. And then that idea of thinking about sustainability from a business model standpoint, and also top of mind for you. And I think a theme of this year's conference for sure, as so many folks are thinking about shifting from government-led donor dollars to direct to government paying for the services that folks are providing. What gets you excited as we turn the corner into next year? You obviously have already reached scale with this program. Are you thinking about other countries or other forms of digital health technology? What's top of mind for IRD?
So one is expanding our work beyond the geographies that we're present in terms of our country offices, right? That's why we're here in Africa, because one thing, this is my second time here at GDHF.
You came last year?
I came last year.
All right.
And we got a booth this time because we wanted to showcase our work.
I love it.
And the reason is that it really amazes me that such amazing work is happening on this continent.
Sure.
And it also gives you not just the continent, you get access to people from all across the world. I think some of the things, it's quite interesting. Even when we look forward, what do we have top of mind is again stuff that's been talked about over the last couple of days here. AI, how to use it appropriately, how to use its analytical skills to support district health management in operating better. How can we take this technology to other countries? Those are some of the questions we're here to answer. This booth, I often tell people I meet, this is an aspirational booth.
Sure.
We're showing what we can do,
Yeah.
because we're aspiring to do more.
Yeah.
And that's where we need these partnerships. And you spoke about the challenges around funding these days, right? I think they underscore this situation right now, underscores the need for more and more partnership. And it can be private partnership, it can be private-public partnership, all sorts of partnerships today are needed for us to take collective action and keep moving the needle.
Yeah, and I'm glad you said collective action too. I do think this community is so resilient in that sense, and as hard as this year has been for so many, there is a creativity that emerges in this kind of ecosystem and environment. And we're all kind of hardwired to partner, to do things together. So I'm glad that you're part of it. I'm glad that you're taking the lessons you learned in Pakistan to scale. That scale is incredible. And bringing some of that wisdom in the most humble and thoughtful way to exchange with this community. So we thank you for coming by the pop-up studio. We thank you for engaging and for the work you do. It's really incredible. And we hope you have a great rest of your conference.
Thanks, Nick, and amazing work by the GDHF team.
Awesome. All right, Zaid, take care, friend.
You too.
Okay.